Good afternoon, San Diego. This is Dr. Jason Schumard with Integrative Wellness Center of San Diego. And today we're going to be doing a short little talk on thyroid. And again, we spoke last time about, why is my thyroid not working? Many women and men, but mostly women, are going to be suffering from thyroid conditions. The statistics are pretty staggering. 1 in 6 to 1 in 8 females will have a thyroid problem in their life. So it's pretty significant numbers. This is going to be our part 2 version. Just to give you a repeat of what we talked about, short version of what we talked about last video. If you did not watch that last video, make sure you go back to that last video. Why is my thyroid not working? And obviously we talk about the thyroid epidemic, right? So this is one of my books that I've written on why there's so many problems with the thyroid and some of the missed things that are happening in the medical avenue. So, as we talked last time, we spoke about the situation that many individuals, specifically women, go through as they're dealing with a thyroid condition. Many of them will experience multiple types of symptoms. These thyroid symptoms, not only could be linked to thyroid, by the way, but let's talk about some of those symptoms again. There could be hair loss, fatigue, weight gain, anxiety, depression, pain like joint pain, digestive issues like constipation or diarrhea, brittle nails where your nails are breaking, the outer edges of the eyebrows like getting really thin. So if you're noticing some of these symptoms, you very well could have a thyroid problem. Now, what's interesting though is that you could go to your doctor and your doctor could run a blood work and they'll run TSH. We talked about that last video as well if you want to look at that. But they'll run TSH, and your TSH, which is referred to as thyroid stimulating hormone, it's the main marker analyzed by the medical world to determine if you have a thyroid problem. Is it a low thyroid? Is it hyperthyroid, also referred to as Graves' disease? Or is your thyroid functioning normally? Many individuals will go into their doctor complaining of these types of symptoms, and they run a test and the doctor says, your thyroid's normal, everything's great. Well, if that's the case, then obviously it's something else, but many times they won't look into whatever else is going on and the individual will leave and continue to suffer with those types of things. We're not going to talk about that so much today, but just to remind you of the markers that you should be analyzed if your thyroid stimulating hormone comes back. So if you have a thyroid condition, or actually if you don't have a thyroid condition, you want to make sure if your doctor is telling you that your thyroid looks normal, that you have to expand the labs. You have to look at other markers. There are 10 markers that should be ran. And those 10 markers, and if you want, I'll place them in the comments again today in this video so you all have those. But those markers should be TSH, or thyroid stimulating hormone. The other marker should be T4. The other marker should be free T4, total T3, free T3, free thyroxine index, or also referred to as F as in Frank, T as in Taylor, I as in italics, FTI, T3 uptake, reverse T3, thyroid peroxidase, also abbreviated T as in Taylor, P as in Paul, O as in octopus, TPO, and thyroglobulin antibody. Those 10 markers should be the markers that should be ran, in my opinion, which is very biased, obviously, because this is what I do every single day. Every single time you are analyzing someone with a thyroid condition or the possibility they have a thyroid condition that they're experiencing. So knowing the type of markers that it should be ran is going to be very important to make sure you play a role in your overall health. So we talked about that last time. I just wanted to do a real brief overview of that. But today I want to expand that into going to the next situation is, let's just say that your doctor has ran your blood work and he or she ran TSH and your TSH is normal, and they're saying, well, the symptoms you're currently experiencing are not due to your thyroid, if you have a thyroid problem, or if you don't have a thyroid issue, are not due to your thyroid. Everything is working well in the thyroid. And let's just say they were they did run the other thyroid markers, which is very unlikely. And doing this work for almost 15 years now, I've never seen anybody run a full thyroid panel of everything I just spoke about. They may run T4 or T3 or free T4, but they're not going to run the full panel. So let's just say they did run the full panel and everything came back normal, and it's truly not a thyroid issue. As I mentioned at the beginning of this presentation, it could be something else. The symptoms of a thyroid condition can mimic other areas. So what I mean by that is you may not have a thyroid problem. You may have some or other type of organ or other problem that is mimicking the same type of symptoms of what the thyroid symptoms look like. So it's not uncommon for me to having a discussion with a patient, and they're saying, well, my doctor says my thyroid is normal and I still have, I still have hair loss. I still have weight gain. I can't lose any weight. It's like really frustrating. I have fatigue. I'm tired all the time. I can't sleep. I have joint pain, like these things, constipation. We're hearing these symptoms, and I'll run a full thyroid panel and the same thing. I won't see anything going on there. So it's obviously something else that's the problem. So what that means is that you can't just rely on these types of tests. You have to look at other types of testing as well. We have to expand the comprehensiveness. So that's what's so great about functional medicine. And if you're watching this video and you've never heard of functional medicine is trying to analyze the individual to see where their body has lost function, which is then going to be the cause of whatever symptoms they're going to be experiencing. So just because the thyroid is quote unquote normal does not necessarily mean that something else could be going on. Rather, in a traditional medical model, if you have digestive issues, they're going to give you a medication like omeprazole for the digestive issues, or maybe recommend something like Miralax or some other type of product to help you with your constipation or those sort of things. If you have hair loss, maybe they'll give you some sort of other medication like a shampoo or something for that type of thing. If you've got maybe some depression going on, they're going to give you an antidepressant. If you start having blood pressure issues, they're going to give you a blood pressure medication, and so on and so on. The point is, traditionally in a medical model, what they're going to do is they're going to give you a pharmaceutical drug for the treatment, or for the symptom, I should say. And so it's one pharmaceutical drug after another. It's not uncommon for me to see individuals who have come to see me because they have a thyroid problem or think they have a thyroid problem, but they're already taking so many other different medications because of the symptoms they're experiencing.